I am Dr. Sagar Rajpur, ENT specialist doctor from Nashik, Maharashtra. Video topic of today is scabs after tonsillectomy. The thing is that whenever tonsil surgery is done, there are scabs. Scabs fall out of from your oral cavity after 10 days, after 5 days, after 3 days, after 8 days, whatever. Okay. So we give instructions to each and every patient that the more you start gargling, the more earlier you start gargling, the more earlier you start taking your diet, the more early the scabs will fall off, and more early there will be the healing, and at the earliest you can join your duties. But there are many people who don't start their regular diet, or diet which is recommended, immediately after surgery. They don't do gargling, they don't start regular diet, they don't eat anything. So in such people scabs don't fall early, and throat pain also doesn't decrease. These people complain of throat pain for much longer time, for much more days, and they don't start their regular duties. They are too late. So this is the problem. So usually we find in our experience that children who are staying in rural areas, they are sons, they are children of daughters, they do rigorous physical activity, they start eating too much early, they start gargling too much early after tonsillectomy, and in such people scabs fall at the earliest. Watching this video is not sufficient. It is very important to click on the link given in the description of this video, because video will not provide you entire information. Video provides you very limited information. This thing I am mentioning in each and every video. So these are very important things. So children in rural areas who are doing too much rigorous physical work, they start gargling, eating too much early, they start taking their diet too much early after tonsillectomy, and in such candidates the scabs fall very early, and these people heal early, and they start their regular duties too much early as compared as to the children of urban areas. They are so scared, they start complaining of throat pain and all, and they refuse to take the regular diet, gargling. So in such patients the throat pain lasts for too much longer time. This is our experience, frank experience. And we have to keep on insisting them, keep on reminding them, their parents, to keep watch on these things. So basically, what is a scab, tonsil scab? Whenever there is a injury to your skin by scratch, you will find that there is a blackish line, which forms over there. There is a scab that forms after this. Similarly, during tonsillectomy surgery, there is iatrogenic injury. Without taking incision, we cannot remove the tonsil. So we have to take incision. That is a kind of injury. It is iatrogenic injury or whatever injury, it is an injury. It will result in scab formation. So this will fall at the maximum after 10 days, but it starts falling too much earlier. So at what time should you report to your ENT specialist doctor in case there is too much problem like bleeding, or too much pain? What is the function of scabs? What is the basic purpose they do provide? At what time they should fall off? What things should you do so that your scabs should not fall too much early and create too much problem? For all these things, it is very important to click on the link given in the description of this video. It is very important. You should know all these things right from ABCD. Your treating ENT doctor is very busy in surgeries and consulting, so he is not able to explain you all these things right from the beginning.